And now to introduce our second innovator sponsor from Kite, a Gilead company. Joining us from Kite is Aliya Omer, Vice President, Corporate Development and Head of Global Portfolio and Program Strategy. With nearly 20 years of experience in the pharmaceutical and consumer healthcare industries, Aliya is responsible for providing business, financial, scientific, and strategic analysis to shape and deliver on Kite's corporate strategy. She is accountable for advancing Kite's portfolio, evolving its pipeline, and shaping disease areas strategies to drive its future growth and deliver pioneering innovation to patients. Aliya received a bachelor's degree in materials science engineering and biomedical engineering from Carnegie Mellon University and MBA from INSEAD. Aliya, welcome to LA Best 2023.
Thank you so much for that kind introduction, Mark, and thank you to the Chancellor for the invitation to speak at this year's LA Best. Having attended last year, actually, I have to say that this forum really creates, I think, a very much needed space to bring stakeholders together across the innovation continuum, whether that's starting with students and faculty, but also expanding to top-notch researchers, scientists, and industry so that we can collectively think about how we shape the future of this environment in LA. I must say, from a personal standpoint, my husband and I are very tied to LA. It's our third time living here. And he being part of the aerospace engineering or aerospace industry, as Chancellor mentioned earlier, and myself in biosciences, we couldn't think of a better place to raise our families. So it's really phenomenal to have forums like this for us to get to know one another and to really seek out how we collaborate with one another as well. Our mission is singularly focused on cell therapy, and we have a really bold ambition. It's not just to treat, but to cure cancer. And the way we do that is to make sure that we're really operating as one team in a really vertically integrated manner. So what that means is bringing together research, development, manufacturing, and commercialization into one integrated team so that we don't drop the ball at any time for patients that are in need. And by doing this, we are really proud to share that we've reached over 14,000 patients with our therapies. We have 2 approved therapies, which are available globally across 5 indications, predominantly in lymphoma and leukemia. And it all starts with our people. We are 4,000 people strong now, employees, and if there are any future interest, we do have our booth here today as well, and would be more than happy to talk about how you might and your talents might contribute to the future of Kite as well. As I mentioned, we do have global presence. Here in LA is actually in Santa Monica is our global headquarters, but we also have research and manufacturing facilities in California as well. We have a regional hub in London, in the UK, and we also have presence in China and Japan. So truly a global presence because we know that there are patients in need everywhere, not just locally. Recently, we've been putting a lot of emphasis on how we evolve our pipeline. I've been with Kite for 3 years, and I can say that we've really seen a transformation in the way we express, the talent that we have and how that manifests itself into the products that we're delivering. Most recently, we just closed a deal with Teamunity, which is a private biotech company based out of Philadelphia, now known as Kite Philadelphia. And what they're doing is giving us access to both preclinical and clinical assets, armored CAR T technologies, and beyond that will supplement and complement our own internal research efforts that we have. In addition, we closed a deal with Arcellx, which is actually a broad co-development and co-commercialization deal, which essentially will allow us to enter multiple myeloma with a BCMA, ddBCMA targeted asset. And while we won't be first in class, we do believe that this asset, based on the data thus far, has best in class potential. And as many in this room can, I think, relate to, multiple myeloma still has a very high unmet need from a patient standpoint. So we hope that we can contribute to the lives of patients and their families in this way. This is just a snapshot of our pipeline. I think here, what I would really highlight is just the expansive nature. We're really looking beyond leukemias and lymphomas and really trying to understand how do we expand the promise into solid tumors while also looking at how we get patient's product faster. We know that a lot of the product is based on our process, and our colleagues, my colleague Mitra Cruz will be speaking later today and talking a little bit about how rapid manufacturing and harnessing a more juvenile cell type can actually help deliver greater efficacy and safety for our patients. So truly, I think the work that we do, we find very rewarding. We can't do it without the ecosystem around us here in LA and in Southern California. It's really a privilege, I would say, to come to work every day, to work with a team that is so ingrained and so dedicated and has such heart in the work that we do. So we take pride in being a global leader in cell therapy. We are looking at modalities that span not only within CAR T cell therapy, but we're also looking at different cell sources and cell types to advance our therapeutic areas. So with that, I would just like to thank everyone here, and I'm really looking forward to many engaging conversations today and into the afternoon. Thank you so much.